My name is Dr. Larry Gelman. I'm an associate professor at the University of Manitoba, a visiting lecturer at the University of Nairobi, and the senior manager of the University of Manitoba projects in Kenya. The University of Manitoba has been working in Kenya since 1980, has built several structures for the University of Nairobi, the most recently being the building behind us, which was constructed between 2004 and 2006 with funds from the Canadian Foundation for Innovation as well as the University of Manitoba. It houses laboratories, including one of the few enhanced level 3 laboratories in Africa, as well as offices for the University of Manitoba, other collaborating partners in this collaboration, and the University of Nairobi Institute for Tropical and Infectious Diseases. Since we started working in Kenya in 1980, the University of Manitoba has basically been focused on sexually transmitted diseases and HIV/AIDS. And much of the information that we know about the natural history of HIV/AIDS in Africa comes from the research conducted by the group, the University of Nairobi, University of Manitoba, and its collaborating partners.
This is one of the most fruitful collaborations in the University of Nairobi. In fact, it is the oldest, the most expansive, and the most fruitful.
We've also, over the last 5 years, with the support of the American PEPFAR program, begun to offer treatment and care and prevention services to a larger community, which has included the opening of the SWAP clinic.
Up to about 2006, we had about, I would say basically, 2 main clinics. That's Pumwani, where we basically took care of mothers and children. And then in Majengo Clinic, it's a dedicated sex workers clinic. In 2006, we went flat out to actually do mobilization within Nairobi, and we decided to approach CDC Kenya, which was kind of friendly towards providing what I would call prevention services. And what we did is we put up a small proposal whereby we proposed creating what we call a sex workers outreach program, SWAP.
The model is not so much research, it's more care. It's about educating the sex worker, providing preventive services, treating, screening for STIs and treatment and ARV therapy.
We are about 17 staff here. We have 1 physician. We are providing what we call a prevention package, and we are using the national guidelines for the sex workers, which stipulate on what to give when you set up a program for the sex workers. One of the services that we give is health education. We are currently serving almost 6,000 female and male sex workers. We still don't have very many male sex workers. We have about 300, the rest are female sex workers.
SWAP has really helped me this clinic because I had vowed never to do a HIV test. Because initially I had when you're in sex work, you get like condom baths. I mean condom ruptures or tire baths, that is what we call them in the street. So when I used to have so many of those, I didn't know so many things, but I insisted on condoms. So I had vowed never to take a HIV test. But when they came to the clinic, when I came to the clinic, I was counseled and I agreed.
The people who you used to see that they are HIV positive and they came here like they were dying, they have risen up, they have returned to people, and actually, unless I tell you I'm positive, you won't know I'm positive. And it's that courage to accept my sexuality, to accept that I'm a sex worker and I'm also, HIV positive. It takes courage, but that courage we have gotten from SWAP.
I get free medical service. I know now so much. I know also my rights. I know so much about the use of condoms, how to protect myself in case I get any kind of infection.
Welcome to Pumwani MCH Clinic. Basically, this clinic has 1 doctor, 3 clinical officers, about 8 nurses, 2 counselors, 1 data clerk, and 1 cleaner. Currently, the clinic has about 4,000 active patients, out of whom around 1,800 are on ARVs.
Hii clinic imenisaidia sana tangu nianze hiyo 92 vile niligive birth. Nimekuja nimepata usaidizi mingi, nikikuwa mgonjwa natibiwa. Hizi madawa za OIs hizi ukienda kwa hospitali nyingine unanunua, lakini hapa tunapata for free.
We actually enroll almost 20 patients every week. So our numbers are growing. demand for our services is increasing every day.
Mimi nimefaidika kutoka hapo, nimefaidika sana. Nilikuwa mdogo msichana, nilikuwa ale hapo karibu 82, 83 hapo, na vile nilikuja hapa nimesaidika sana, kwa maana hata nimekaa nikaguduliwa magonjwa mengine hapa tu. Magonjwa mengine kama ningekaa nyumbani singejulikana.
We're not reaching all the sex workers that we could reach, and so we'd have to increase our outreach services.
The impact of the program has been seen in a variety of areas. Perhaps one of the more significant results was the circumcision trial in Kisumu a few years ago that was conducted by the University of Illinois, University of Manitoba, and University of Nairobi, that has led to global policy changes regarding male circumcision as a prevention for HIV/AIDS.
Over and above getting money to provide the necessary support, the other things that are being left out that are very, very important in terms of programming. So infrastructure has been left out. You need space to provide these services. You even need additional tools to provide these services, but they are non-existent.
I suspect that there will be continued challenges, continued research questions, and continued need for more research and programs for many years to come.